Hello, this is our Exercise Science 318 corrective exercise CLC project, including myself, Jackson, Faith, Ethan, Caitlin, Sydney, Adia, and Liam. And here we go.
So our assessment was for a 29-year-old man who works a corporate finance job. He's 6'1", his BMI is 24.8, and according to the PARQ, like he did not indicate yes, so he doesn't have any chronic health conditions that are like chest pain or heart conditions. So for his occupation, he spends about 7 to 9 hours a day sitting. He hunches over because he is tall. He has poor posture. He repetitively types and makes phone calls. With his right hand, he makes the phone calls. And then he also is stressed a lot for his job. His lifestyle for recreation, he likes to play pickleball 2 times a week, and his hobbies include cooking, trading stocks, and reading books. His medical history is that he played volleyball in high school and he tore his ACL. He complains about low back pain and headaches. His chronic conditions are mild asthma, and he was prescribed an albuterol inhaler.
Okay, for the anterior static posture analysis, we analyzed Jackson and we noticed that he had pronated ankles and that his knees were slightly valgus, and he had a slight weight shift onto his left leg, which in turn he also had a slight neck glide to the left, and his traps were elevated.
Hello, my name is Ethan, and looking at the lateral static posture analysis, starting with the head and neck, the head is protracted, which means it's more forward and more anterior than it should be. Then moving down to the shoulders and arms, the shoulders are protracted, which means they're also forward, and that is accompanied by thumbs that are pronated, which means that they're rotated medially. Then moving down to the trunk and the lumbopelvic hip complex, the patient does have kyphosis, which is the rounding of the upper back. It's also referred to as gamer boy posture, and that is the up in the cervical and upper thoracic area. And then there's no visible lordosis, which is due to the larger shirt, so we can't see for any anterior pelvic tilt or anything along those lines. And then looking at the knee and the leg, there's good femur angle with normal posture, so nothing to worry about there. And then lastly, for the lateral aspect, looking at the feet and ankle, it's a neutral stance, so he's not too far on his toes, not too far on his heels. Then moving to the posterior static posture analysis, the head and shoulders again, there's a lateral head glide to the left, and then the left shoulder is slightly elevated. So these things are kind of accompanied together, and then moving down towards the trunk. The trunk does have slight lateral side bending to the right, and then looking at the scapular height and the distance from the mid-sagittal line, they look very even for the most part, with a slight elevation to maybe the left side. And then looking down at the lumbopelvic hip complex and the legs, there's even hips and no lordosis. And then lastly, looking at the feet and ankles again, there is just straight Achilles.
Hello. For the anterior transitional overhead squat, it looks like Liam kind of has the feet pointed out, and this could potentially, I also saw like some potentially flattened feet. And then for the knees, it looks like they're kind of varus, and this could indicate an underactive adductor complex or gluteus maximus. And then looking at the lumbopelvic hip complex, there was nothing noticeable here. And then for the shoulders slash upper body, it looks like his chin is slightly tucked rather than maintaining a neutral head position. And this could be indicating some limited shoulder flexion and compensating by bending the arms. And then for the lateral view, for the lumbopelvic hip complex, the low back is arching slightly, and this could potentially indicate underactive intrinsic core stabilizers. And then for the shoulders, the arms are falling forward and do not fully extend overhead. This can indicate tight lats and underactive rotator cuff muscles.
Looking at the foot and ankle region, we can see his feet are pointing outwards with slight pronation and his heels staying in contact with the floor. And looking at his knee posture, they are varus. And looking at the lumbopelvic hip complex, we can see it's pretty normal. And looking at the shoulder position level, the right side is slightly elevated, along with his shoulders having a limited flexion, causing his elbows to also be bent. And looking at his head, or we can see that he has some forward head posture.
For his range of motion assessment on his shoulder, his right arm uh, had a larger angle than his left arm did. Normal is about 160, and he was above 175 in both cases. We think this is because of type traps, because of possible poor posture or hunching. And that is his shoulder flexion analysis.
Hi guys, I'm Liam. So I'm doing the strength assessment shoulder flexion. As you can see in the picture, I have Ethan helping me out. He's got one hand placed like kind of humerus in between elbow and deltoid, and the other hand placed on like the kind of like the lower back, maybe around serratus anterior to help support and make sure that I'm having no outside compensation for my shoulder flexion test. So I have my arm straight out, kind of like shoulder level, maybe a little bit lower. Other alternatives it would be the patient or me sitting down in a chair to make sure that the back is engaged or my back against the wall. So I'm trying to flex up or essentially put my arm up and resist the Ethan's kind of like pressure or force downwards. So I actually received a rating of 5 on the NASM scale, as I had no abnormalities. And as you guys can see in the other slides, I was able to go like normal ROM or range of motion in addition to resisting his resistance of pushing my arm down. So yeah.
All right, and then looking at our references, we start with the textbook, which is the National Academy of Sports Medicine Staff, NASM Essentials of Corrective Exercise Training by Burlington and Jones. And then going downwards, we've got Science Direct from 2013, Postural Assessment and Postural Assessment. And then Walden M. in the Trapezius Clinical and Conditioning Controversies, the Journal of Bodywork and Movement Therapies, and then Manual Muscle Testing of Shoulder Flexion, which is a Physiopedia. Then looking at team member responsibilities, Faith laid out the slides for the group, took the photos for the presentation, and was responsible for the anterior static posture analysis. Ethan, produced the lateral and posterior static postural assessment slides, as well as demonstrating the testing for the range of motion and strength assessments. Caitlin was responsible for doing the sample health risk assessment part of the range of motion slide. And then Sydney was responsible for the posterior transitional movement assessment and the overhead squat. Adia did the overhead squat assessment and anterior lateral view slides, and then Liam did the strength assessment slide and including description and grading, as well as using some of the pictures, or as well as participating in being in some of the pictures for the slide. And then lastly, Jackson did the slide about range of motion. This is our corrective exercise principles, CLC. Thank you for watching.